Hello everyone. We are in our 7th session of the Cancer Prevention Seminar. Today we will talk about prostate cancer, one of the most common cancer among men. As you see in the slides, the prostate cancer is one of the most frequent cancer in the United States and in the world. It might not be the main cause of death because many people with prostate cancer, many men with prostate cancer, sometimes the cancer comes at a late age and I have some friends that had prostate cancer, did the treatment, and they die with a heart disease and they die with Alzheimer's and nothing related to the prostate at all. Well, this is today's joke. Your cancer risk, well, I only can tell you for sure that you will never have prostate cancer. Okay, a lady will not have prostate cancer. Sorry about the joke. Prostate cancer is the most common cause of death from cancer in men over the age of 75. Prostate cancer is rarely found in men younger than 40. And usually when it's found in this age, it is very aggressive. So that's why it's important to check some features on that. The early diagnosis for prostate cancer is the PSA, or prostate-specific antigen. Also, they use the digital rectal examination that many men are afraid of that. For men over the 50 years old. 20% of prostate cancer can have a normal digital rectal examination. So that's why this is a procedure, important procedure when you don't have PSA or other methods, but is not very accurate to detect the cancer. The PSA is a marker of prostate cancer produced by the cancer cells. A value of 5 would be the threshold. Above that, we should be referred to a specialist. The person should visit with a urologist for further examination. So the normal would be less than 4. This is more likely what's happening with PSA. So you have some people that will not, you do the PSA and you have a number of people that are false positives. And then you have some that you found that they have the cancer, and then you have some that unfortunately, you missed the cancer with that, and they had the cancer. So there is always this risk for tests, and PSA was under a big fight in the last years because they said that, well, this test does not help. What I would say is that what is important is to know your PSA from baseline. And then once in a while or every 2 years, if the PSA is normal, you do a check to see if it's normal. What is more of a concern is when you have an increase. So your levels might be 0.5 to 1 and, or 1 to 1.5, and all of a sudden increase for 5 or more, then you should check with a doctor. But the important part is that you should have at least a baseline to know what is your level to begin with. So if a person is an African American and has a parent, a father, that was diagnosed with prostate cancer before 65 years, he should start a PSA with 40 years. So usually we don't start a PSA before 50 years because the cancer is not common before 50 years. In this case, a PSA of 2.5 would indicate a referral, to the urologist. So we don't expect that the person gets to 4 or more to indicate a referral. If the PSA is 2.5 for these African American men with a high risk of prostate cancer, they should be referred. It's the second more frequent type of cancer in male around the world. It's the 6th most common cause of cancer death in the world. As I mentioned, it is one of very frequent cause of cancer, but around the world is not very common as a cancer death. 60% survive after 5 years, and in the United States is 78%. It's the second cause of cancer death in the United States. Because the population in the United States is very old, and I mean there is a big population with old age that die of this cancer. But why the survivor or the survival in the United States is 78%? Compared to 60% in other countries. It's mostly because the treatment is or the screening is able to get these guys early in the process of cancer. So that's why it's important to have digital rectal examination and PSAs and other tests in other countries to approximate the prevention that we can have in the United States. What are the symptoms? The symptoms for prostate cancer might be at a late stage, but it would be delay or a slow at the start of urinary stream. It would be quibbling or leakage of urine, most often after urinating. Slow urinary stream. It can be straining during the urination, or not being able to empty all the amount in one time, or blood in the urine or blood in the semen. And of course, pain or tenderness. Again, is when you have the symptoms, you have two problems. One is that some of the symptoms might happen all the time, and it does not mean that the person has cancer. But sometimes when you have the symptoms, it's too late. In any case, if you have something like that, you should go for a consultation or at least have your PSA checked. So we already mentioned that is more common in African Americans. Increase risk with men that have a mother with history of breast cancer, but it has to be breast cancer pre-menopause. We will talk about breast cancer in the next sessions of this cancer prevention seminar, but we know that we have two types of breast cancer, premenopausal and postmenopausal in women. So if a person has a mother with breast cancer premenopausal, it means that some genetic influence will lead to have a higher risk for men to have a prostate cancer. And also, we know that the men's hormone testosterone is a promoter of the prostate growth. So that's why it's important for men to check this, and that's why it's a cancer that only happens in men. Most men would die of this cancer if they reach the age of 100 years old. Men are more likely to die with rather than from prostate cancer. So is something that is an epidemic among men. But it's rare in men younger than 40. So older men, 60 and plus, are an increased risk if they have contact. So this is other factors that could be in effect, like the orange agent, if they drink too much alcohol, if they are farmers, if they have high fat and animal diet, if they work in plant with tire plant worker, if they are painters or they are exposed to cadmium. So those are mostly related to extra lifestyle that might relate to this cancer. This is the cancer for high income countries, like in the United States. 100 people over 100,000 have the cancer. So in Asia, only 10 people over 100,000 are having this type of cancer. But it's interesting that when these Asians or Africans immigrate to the United States, they increase their incidence of this cancer. And when they move to cities that are resembling the United States now, it's very common that a person lives in the rural areas, move to a city that has all the junk foods and the lifestyle of the Western countries. They start having a higher incidence of this cancer too. But if we go and check what happened to the China study that was done by Dr. Campbell from Cornell University in New York. I met this guy personally one time during a conference of the American College of Lifestyle Medicine. And then they have some very interesting statistics. In some parts of the China, in this study, the rates of Chinese, the prostate cancer among Chinese was 1 over 100,000, 1 per 100,000 people in China. And then in San Francisco, in the Chinatown in San Francisco, the rates are 19 over 100,000. By the way, I like the Chinatown in San Francisco, and that's one of my favorite places in the city. And they have good food, and they have some foods from China. I used to work in Hong Kong. It's good for me to be there in that place. But unfortunately, the Chinese Americans, the Chinese that immigrate from China to San Francisco, they have 19 times the risk of prostate cancer compared to the compatriots that stay in China. And why is that? Probably is related to diet. Probably is related to diet. They start eating more fat, more animal foods, essentially. It's not even fat. I was in Hong Kong, they eat a lot of fat. But when you add more animal foods, it looks like you have a higher risk. And that's why that's what Dr. Campbell found there. So what are the options for the treatment of prostate cancer? They have what they call watchful waiting. If the cancer is discovered in a person over 80 years old, and then the cancer, they have some scores to evaluate the cancer, as I will show in the next slide. And then the cancer is not aggressive, so they might not do anything. They will say, okay, I mean, you are 80 years old, you might not die from this cancer. And that's what happened. And so this is, of course, the decision of the doctor, the urologist, or the doctor that is in charge. Other options are surgery, radiation. In Loma Linda, we have the proton therapy. The proton therapy is a form of radiation that goes to specific parts of the prostate and can kill the proton, kill the cancer cells in a very small place in the prostate. Then they have hormone therapy, cryosurgery, chemotherapy, immunotherapy, and high-intensity ultrasound therapy. The Gleason scores show when they do the surgery of the prostate or when they do a biopsy of the gland, they can figure it out how advanced is the cancer or how aggressive is the cancer. So usually for scores 2 to 5, they are considered low grade, and those are the ones that they put in watchful treatment, and they don't do anything if it's an old person. Then the other ones, 6 to 7 and 8 to 10, are a little more aggressive, and they should be a little more careful, and they should require a little more treatment if the treatment is possible. So sometimes when the Gleason score is 8 to 10, the cancer might be already very developed and might have sent metastases to other organs, and then the treatment is going to be very complicated. Remember, the early the diagnose, the best the treatment. That's it. That's what is more important for cancer, and that's what I still advise people, men, to do the PSA. So some of the evidence are saying in some studies that men who eat more animal foods, meat, poultry, dairy, will have more likely to die from prostate cancer and have an aggressive form of it. And men who are eating more unrefined plant foods and nuts were the least to die from this cancer. So there is some evidence for that, not very conclusive, but we can say that going for a more vegetarian diet is a good idea. We know that selenium-rich foods are very important for the prevention of prostate cancer, and then mushrooms are the ones that are very rich in selenium. You have eggs also, barley, sunflower, and mustard seeds. And even oatmeal are rich in selenium. And in another slides, I will show one of the foods that are richest source of selenium, and that is nothing else than Brazil nuts. So all nuts are rich in selenium, but especially Brazil nut, it contains the amount of selenium that you need daily. Totally 100% of the daily allowances for selenium. For prostate cancer protection, people that eat more beans and all the beans family are more likely to have a lower risk. It is not being very confirmed by recent updates, but this is something that is good, so it doesn't hurt to eat more of these foods. Also, the ones that are rich in vitamin E look like they have an effect. Seeds, almonds, olives, avocados, beans, and wheat germ. In the Adventist Health Study 1, they have 175 cases of prostate cancer. And then they found that the frequent consumption of dried fruits decreased the risk for 40%. Tomatoes and beans probably are protective, and fish eating increased the risk by 50%. This is the Adventist Health Study number 1. We are undergoing now the Adventist Health Study number 2, and more results will come from that one that will confirm or will disconfirm or not confirm these results. So in terms of tomato, it looks like tomato is one antioxidant of the carotene family, and it looks like it has an anti-proliferative effect on cancer cells or block cancer cells to grow. And they also reduce LDL cholesterol and improve the immune function and decrease inflammation. So it has all the potential to be an antioxidant or an anti-cancer element. And lycopene is rich not only in tomato, but in all red substance or red foods like watermelon and other red fruits. Now we will have a video that will talk. So this video will be about prostate cancer screening. Let's see if the video will be good for you to watch now.
An earthquake today in the debate over men and prostate cancer and that simple blood test called a PSA. 20 million men use it to find out if they show a sign of risk. Yet today, a government task force is saying healthy men should skip that test, arguing that the treatment that often follows the test may not be worth the consequences. All this amid a firestorm of response. And here's ABC's Sharon Alfonsi.
The PSA is just a simple blood test, but the government task force suggests the test, for too many men, ultimately leads to more harm than good. Here's their argument. A man takes the test and gets a positive result. Further testing follows, revealing cancer cells in his prostate. More often than not, the decision is made to attack the cancer with surgery, radiation, or both. But the panel says statistics show the man's cancer could very well have been harmless. That the greater danger comes from the possible complications of treatment, impotence, incontinence, and in a tiny number of cases, death after surgery. Even the man who developed the test is now calling its widespread use a public health disaster. But try telling that to William Dalal. Just today, the 61-year-old found out he has prostate cancer.
Had I not had this test, we probably would not have found this because I did not have other symptoms.
Herb Lepore is Dalal's doctor and chairman of NYU's urology department.
I want the cancer out.
Lepore says the task force is ignoring the fact that there's been a 40% reduction in prostate cancer's deaths since PSA testing's been in place.
To say that we shouldn't get PSA, that takes us back to prostate cancer literally being a death sentence.
And while the government panel points to statistics as a reason for healthy men to skip the PSA, William Dalal points to his family as the reason he took it anyway.
I have a wife and two lovely boys, 15 and 16, and I plan to be around for a long time with them, so I'm happy to have the ability to treat this cancer early.
Sharon Alfonsi, ABC News, New York.
Joined here now by our health and medical editor, Dr. Richard Besser. Okay, Rich, this is the sort of thing that drives people crazy because it's so confusing. Where do you start?
Here's my advice. Don't have this test done until you understand what may follow after that, what all the risks and benefits are. It's your body. And so have your doctor walk you through it. If I have a high result, what may come from that? What would we do? Once you have that information, you can make that decision because in the end, it's a personal decision every man needs to make. I reviewed the evidence for me and decided not to have the test.
Because you don't have risk factors in your family? Or?
I don't have risk factors, and I think within the next decade, there's going to be a better test.
Run through risk factors for me once more.
The biggest one is age. The older you are, the bigger the risk factor. African Americans are at greater risk, and if you have a first-degree relative, a parent, a brother, an uncle, that puts you at increased risk.
So you're not saying everybody should not have it. You're saying first talk and understand what it does and doesn't do.
This is one of those where one size does not fit all.
Okay. Dr. Richard Besser, thanks again.
And now for the good news regarding this cancer. There is some other substances or foods that are being studied with a perspective of benefit for people with prostate cancer, like pomegranate. Pomegranate juice might slow the progression of prostate cancer after the treatment. This was done in the Stanford University. And then they control with a PSA, and then they figured out that for men who drank the juice, they have one stable, 4 times lower level of PSA. And so was a slow growth of prostate tumor in mice after pomegranate intake. So also done in the laboratory a slow development of prostate cancer. So this is very exciting for prevention. High intake of milk and dairy probably increase the risk of prostate cancer. So this is being consistent. In the beginning, they mentioned that would be only for advanced cases of prostate cancer, but the evidence in other studies, remember, we followed the American Institute of Cancer Research or the World Cancer Research Fund book. They are preparing to release a book in 2017. When we are recording these videos, they might be releasing this new book, but they give updates in every time. So the latest update in prostate cancer says that high intakes of dairy and milk might increase the risk of prostate cancer. So summarizing that, prostate cancer is common in African Americans, is the higher incidence. The lowest incidence, at least in the United States, is among the Asians. There is the immigration effect when the countries, when people come from other countries, increase the risk here. Some animal studies are mentioning about the omega-3 fatty acids, the lycopene and selenium, as protective against the cancer. Calcium supplements or dietary might be associated with the risk. So this is being confirmed in the updates in 2014. And tea consumption might protect. Soybean, there is limited data, but it looks like the protection comes from isoflavones substance from soy. The mechanism of milk and calcium would be that milk will increase the insulin growth factor 1, and then insulin growth factor 1 increase the prostate cancer risk in some studies. Calcium will decrease vitamin D, and then we know that rats treated with vitamin D had a smaller prostate tumor. So that's why it's important to have calcium in the diet. Well, not having too much calcium in the diet, because this will increase the risk of cancer, probably because of decreasing on vitamin D. But again, this calls for more vitamin D that comes from the sun or supplements to probably benefit prostate cancer. That's the next level. We should know our vitamin D level. Ideal should be above 25 nanograms per liter. And the main sources of vitamin D are first, sun, second, sun, third, the sun. And then maybe you need a capsule than that, better than that. And the point here is that many people live in California. I live in California, and there is plenty of sun here. But most of us work indoors for hours and hours and go home and they stay indoors. So we are afraid of cancer, skin cancer. But in any way, if we live in a place that there is plenty of sun and we don't expose ourselves to the sun, we better take a capsule for supplementation. Processed meats have a mix of nitrates and salt, which when together, combined together, they might increase the production of carcinogens. When processed meats, when a person prepares meats at a high temperature, it produces heterocyclic amines and polycyclic aromatic carbones, hydrocarbons called PAH. And PAH are carcinogens, similar to the carcinogenics that we found in cigarette smoking. Dr. Ornish was the first doctor to make an experimental study showing that it's possible to revert heart disease with changes in lifestyle, mostly a vegetarian diet, low-fat diet, high in fiber, exercise, and stress management. Dr. Ornish also did one of the first studies on cancer patients. They got 65 men. Okay, Dr. Ornish was also one of the first to research on prostate cancer. His Ornish prostate cancer study has 87 men, and he divided this in two groups. One group was doing a lifestyle change, again with a vegan diet, with lots of fruits and vegetables, low-fat diet, less than 10% of calorie, exercise, meditation, and other stress management. And the control that was doing the normal things. So what Ornish got was that after 3 months, there is a decrease on the PSA by 5% in the lifestyle group, and then there is an increase in 1% in the control group. And after 1 year, the PSA decreased by 3% in the lifestyle, and the control increased by 2%. So in any case, we see that there is an increase So Dr. Ornish study results after 3 months show that there is a 5% decrease of PSA in the group, the lifestyle group, and 1% increase in the control group. And after 1 year was a decrease in 3% in the lifestyle and increasing 7% in the control group in the PSA level. But Dr. Ornish also studies some prostate cells, growth of prostate cancer cells line that they call LNCAP. And then these cells increase the risk of prostate cancer or increase the growth of prostate cancer. So these cells that are increased in cancer, in the lifestyle group were decreased by 67%, and while in the control group were decreased just 12%. So it's a big difference of the decrease that they saw, that Ornish saw in his study. In other study that Ornish did, he was able to figure it out a lot of other factors or genes, cancer genes that were decreased among people in the lifestyle program that he did. So he was able to figure it out that all the oncogenes, or meaning the cancer promoter genes, will be enhanced when the person was not in the lifestyle, and when the person was in the lifestyle, the suppressor genes were enhanced or expressed, another term that was used, and then meaning that really a lifestyle, essentially a diet rich in more vegetable foods, was very important for the prevention of cancer. There was, I will tell you one of my experience with a patient, Mr. Silva, that came to me. He was diagnosed with prostate cancer at 60 years old, and now with 70 years old he came to my office. He had done surgery, but and he has checked a PSA periodically. But one day he checked, and then it was 5 years after the prostate surgery, and then his PSA started to climbing again. And then the guy said, the doctor said to him, okay, you have to go for chemotherapy now, or radiotherapy, because we don't know, you don't have a prostate gland anymore, so we don't know where to find whatever. So they will do irradiation over the whole pubic area. It's kind of a general radiation, or use chemotherapy. And then he decided to increase his intake of fruits and vegetables on that time. And for 2 weeks he was eating almost 10 servings of those vegetables and fruit. And then when he went back to check with the doctor, his PSA lowered to 0.3 to 0.4. And I believe he's still alive today. Maybe he was an old guy, and old guys, the prostate will not grow. But something is there that might confirm what Ornish felt or found in his study, that once you eat more fruits and vegetables, a vegetarian diet, you decrease your PSA. From the American Institute of Cancer Research, there is a confirmation that overweight and obesity increase the risk of cancer. So we confirm the risk of obesity to prostate cancer that we mentioned in a previous chapter of this seminar, but is confirmed in the latest update. Also, tall men are more in risk of this cancer, and probably because tall men, because of growth that they have, during the growth they might use a little more fat and junk food, and then they have abnormal production of testosterone. This is my opinion. But probably development factors in the womb can be also important, and during childhood and adolescence. Beta-carotene, they have an idea that carotene might have a protection, but they didn't find anything related to that. Excess intake of milk and dairy might increase rates, so they didn't disconfirm that. It might be related to cancer. And then selenium in the diet might decrease risk. So that's why we continue promoting mushrooms and especially Brazil nuts. Don't forget that. Then we will talk now a little bit about benign prostate hyperplasia. This is because we will call this BPH from now on, because many times it's confused with prostate cancer. BPH is a medical term for enlargement of the prostate gland. It's common in older men and is not related to cancer at all. So an enlarged prostate can slow the flow of the urine, and then can have upstream effects on the urinary tract, in the bladder and the kidney, and can produce problems there. But is not related to cancer, but can cause kidney failure if it is not treated properly. So it's important to treat this and to know if a person has it. The symptoms are very common, like hesitant, interrupted, and weak stream, urgency and leaking of or dribbling urine, more frequent urination, excessive urination at night, and those are the main symptoms of prostate BPH. BPH is not related to prostate cancer, but the signs and the symptoms sometimes are similar. So we advise that a man with BPH should be checked with PSA, and sometimes should be checked with ultrasound or other tests to confirm if they don't have prostate cancer. They can come together, but they are not related. But they should have a periodical screen for prostate cancer, as all men should do. The treatments for BPH is the transurethral microwave procedure, transurethral needle ablation, water-induced thermotherapy, transurethral surgery, open surgery, or laser surgery. So they have all of these treatments and for this condition. There is some treatment with one drug called Proscar or finasteride, and other drug called Avostar, that are drugs used to treat prostate enlargement. So these are the medication that they advise. If you don't have prostate cancer and your PSA score is 3 or lower, these medications might be indicated. For prostate cancer or those that have a higher PSA, it might be not a good idea to use these drugs. There is one herb that we call saw palmetto. Saw palmetto is in fact a palm tree. And then there is evidence that a tea from that plant that called Serena repens it could help the prostate to dilate and help these patients with BPH. However, the science and the clinical trials have not confirmed that. But as the drug is not a problem and does not offer any contraindications or side effects, we know that sometimes it can help some people. Why not to use it? There is no harm in taking it. This is a picture of saw palmetto. As you see, is a very short palm tree. Other herbal medicines that have been researched to support a systematic review is the beta-sitosterol from African stargrass, or the pigeon plant from the Prunus africana. It looks like these herbs also don't have any side effects, but the effects are not very well, I would say, concluded that are positive, but have had some systematic reviews for that confirm a possible or a probable effect. I will finish this session with Exodus 15:26. If you listen carefully to the voice of the Lord your God, and do what is right in His eyes, if you pay attention to His commands, and keep all His decrees, I will not bring on you any of the diseases brought on the Egyptians, for I am the Lord who heals you. So we use this verse in many of our lectures. The point here is that if you follow a good lifestyle, if you eat a lot of fruits and vegetables, you will have less risk of prostate cancer, as we see in the study done by Ornish. Thank you very much. I will see you in the next chapter of the Cancer Prevention Seminar.